A young girl belonging to poor socio-economic status presents to OPD with fever, dysphagia, dysarthria. Given the past history of TB of cervical vertebrae, she is now diagnosed with a retropharyngeal abscess. The structure likely to get invaded first is A. Cervical fascia. B. Prevertebral fascia. C. Superficial fascia. D. Pretracheal fascia.
Option B is the right answer.
A 25-year female presents with lethargy and irritability for the last 5 years. Labs revealed HB of 9.6, MCV 70 and MCHC low with normal WBC and low platelet count. She was prescribed iron supplements, yet after 2 months she had HB 10. Which lab investigation should be ordered to find the underlying cause of persistent anemia? A. Red count. B. Ferritin levels. C. HB electrophoresis. D. Bone marrow biopsy. E. Total iron binding capacity.
Option D is the right answer.
A 2-year-old boy brought for circumcision has a history of excess bleeding from the umbilical stump at time of birth. 2 cousins bled profusely after circumcision in past. The test likely to give clues to diagnosis is A. BT. B. CT. C. PT. D. APTT. E. Platelet count.
Option D is the right answer.
A known CLD patient with jaundice, generalized edema and ascites. The massive accumulation of fluid in the abdomen is the result of A. Decreased hydrostatic pressure. B. Decreased colloid osmotic pressure. C. Increased hydrostatic pressure. D. Increased pressure in Bowman capsule.
Option B is the right answer.
A known hypertensive lady presented with severe headache, vomiting, and raised ICP. On lumbar puncture, the CSF was blood-stained. What is the most likely cause? A. Subarachnoid hemorrhage. B. Injury during procedure. C. Extradural hemorrhage. D. Intradural hemorrhage.
Option A is the right answer.
The correct sequence of leukocyte extravasation is A. Rolling margination attachment transmigration. B. Transmigration margination rolling attachment. C. Margination rolling attachment transmigration. D. Attachment margination rolling transmigration.
Option C is the right answer.
A type 2 diabetic patient has weakness and increased frequency of urine since 2 weeks. What is the possible mechanism of polyuria? A. Decreased sensitivity of vasopressin to aquaporin. B. Decreased reabsorption of glucose in PCT. C. Decreased water absorption from renal tubule. D. Increased sodium absorption in gut.
Option B is the right answer.
Toxic shock syndrome toxin 1 gene is carried by which of the following bacteria? A. Staph epidermidis. B. Staph aureus. C. Pseudomonas. D. E. coli.
Option B is the right answer.
A patient with amyloidosis is found to have plasma cell disorder, which is the most likely type of protein responsible for his amyloidosis. A. Beta-2 amyloid protein. B. Beta-2 macroglobulin. C. Amyloid-associated protein D, transthyretin. E. Amyloid light chain protein.
Option E is the right answer.
A young lady of 30 years presented in IOPD with history of fever, headache, and diplopia. On examination, it was found that she is having ptosis, mydriasis, anisocoria, and crossed horizontal diplopia. The most likely diagnosis is A. Head injury. B. Horner's syndrome. C. Hypothyroidism. D. Trochlear nerve damage. E. Oculomotor nerve damage.
Option E is the right answer.
The patient of obstructive jaundice may develop bleeding tendency because A. Bile salt is not absorbed. B. Liver is not forming prothrombin. C. Platelet count has decreased. D. Vitamin K is not absorbed from gut. E. Vitamin C is not absorbed from gut.
Option D is the right answer.
A 28-year-old soldier after riding from Siachen Glacier, having spent 6 months there, presents to emergency with complaints of headache and peripheral cyanosis of his fingers. Most probably the cause is A. Polycythemia vera. B. Anemia. C. Secondary polycythemia. D. Physiologic polycythemia. E. Sickle cell anemia.
Option C is the right answer.
The possible cause of spike and dome appearance pattern on EEG is A. Petit mal epilepsy, B. Jacksonian epilepsy, C. Grand mal epilepsy, D. Focal epilepsy, E. Night tremors.
Option A is the right answer.
A 58-year-old man is admitted to the hospital with acute heart failure and pulmonary edema. Which one of the following drugs given for would be most useful in treating the pulmonary edema? A. Digoxin, B. Dobutamine, C. furosemide, D. Amiodarone, E. spironolactone.
Option C is the right answer.
A patient came to emergency after a penetrating injury with shortness of breath and sharp chest pain. On examination, no air entry on right side and hyperresonant on percussion. The lungs collapsed inward and chest sprung outward. Chest X-ray shows trachea shifted towards left. Diagnosis is A. Lung collapse, B. Hemothorax, C. Myocardial infarction, D. Right-sided pneumothorax.
Option D is the right answer.
A pregnant lady with cystic acne was taking medication for it. She delivered a child with cardiac defects, short stature, and cleft palate. The possible drug she was taking is A. Folic acid, B. Iron, C. Calcium, D. Vitamin C, E. Retinoic acid.
Option E is the right answer.
Which of the following antifungal agent is useful in treatment of Cryptococcus neoformans meningitis? A. Miconazole, B. Terbinafine, C. Griseofulvin, D. Nistidine, E. Amphotericin B.
Option E is the right answer.
Which of the following specific granules of different granulocytes first appear during the stage of granulopoiesis? A. Band cell, B. Myelocyte, C. Metamyelocyte, D. Promyelocyte, E. Granulocyte-specific stem cell.
Option D is the right answer.
A 50-year-old man having aching pain in right flank, decreased urine and hematuria. Blood urea, nitrogen S, electrolytes and RFTs were normal. HB18 and serum CA11. On imaging there is a mass in right flank. Diagnosis is A. Polycystic kidney disease, B. Glomerular nephritis. C. Adrenal neoplasia. D. Nephrotic syndrome. E. Renal cell carcinoma.
Option E is the right answer.
Which heart sound is heard at the third intercostal space near left parasternal border? A. Tricuspid. B. Aortic A1. C. Aortic A2. D. Pulmonary E. Mitral.
Option C is the right answer.